One committee is returning back from recess on this. Senator Whitehouse is recognized for questions.
Thank you, Chairman. Mr. Secretary, I want to talk to you about Rhode Island. When you were last sitting there, here's what I said to you. I want to read it back to you because I want it to sink in. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a difference of 23 and 26% in our regional healthcare market. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act that CMS took on this issue years ago was to make it worse. I raised that with you then. I've raised it since with Dr. Oz. I've raised it with CMMI Director Sutton. I would like to get action from CMS on that. One partial avenue of relief for Rhode Island is the AHEAD program. Rhode Island is a willing voluntary participant in the AHEAD program. Coming behind Rhode Island is Connecticut. What remains to be seen is whether the payment rates agreed to for Rhode Island will suffer the same discriminatory discount with respect to the AHEAD rates for Connecticut as Connecticut comes through. I've been able to get no assurances from CMS that they care one whit about this payment differential or that they see AHEAD as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital when Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved. The other problem that I mentioned to you is that I'm now in my fourth round of CMMI directors. It's bloody Groundhog Day, trying to get something done about how end-of-life patients are treated. I'm offering Rhode Island as a willing example of how we can do it better. It is idiotic and cruel to force a family to put their dying loved one through 3 days and 2 nights of a hospital before they can put them in a nursing home. It is equally ridiculous to not allow palliative and curative care to happen together. Providing home care when someone is dying, even if they can still get out of the house or into the yard, is a basic thing to ask. And to have respite care be that somebody comes to the house instead of taking a dying family member to a hospital, that's not even respite. Every single one, Mr. Kennedy, of these waivers has been granted in the past by CMMS and other circumstances. All I want is for somebody to come and work out how we do this in Rhode Island. What is our patient base that we'll do this in, how we put the waivers together. To quote your CMS director, Mr. Oz, he said, as we discussed in your office, we must re-examine how end-of-life care is addressed in this country. I'm offering Rhode Island as an example of how to make it better. I hope you will concede that right now it is not good. So
Senator,
I need you to respond to me. You guys know where to find me. I'm up in the Hart Building.
Yeah.
We've reached out, we've tried for meetings, and the progress in all three of those areas, fixing the payment gap, getting ahead balanced regionally, and following through on our desire to do good things, improving end-of-life care with waivers you guys have already granted, has gotten me so far no place. And forgive my impatience, a lot of it predates you. I put a hold on Biden nominees because I was getting jerked around by your bureaucracy. I'd like it to end and get some progress.
Yeah, Senator, you raised this during my confirmation hearing, and I said to you then, and you were very civil. You raised something that makes a lot of sense to the extent that we have the power to fix it at CMS. I'd like to do it. We've had the same kind of complaints from Vermont. But I said to you at that time, call me and let's come talk about this. You have my cell phone. You can call me anytime. I've never heard from you in 7 months. Call me up. I'd love to meet with you. I'll get Oz in the meeting. And, what you're saying, particularly about at the end of life, it may be something we can do something about. I want to help. Let me know.
We'll try. Forgive my frustration. You've got 30,000 employees. They could have reached out to me. They know where I live.
Yes.
At a Senate Finance Committee hearing, Senator Sheldon Whitehouse, Democrat, Rhode Island, sharply criticized Health and Human Services, HHS Secretary Robert F. Kennedy Jr. over persistent issues affecting Rhode Island's healthcare system. Whitehouse began by highlighting the long-standing problem of payment disparities between Rhode Island and neighboring states such as Massachusetts and Connecticut. For years, the Centers for Medicare and Medicaid Services, CMS, had maintained a reimbursement system that Senator Whitehouse argued could never be justified. According to Whitehouse, Rhode Island providers were consistently paid 23 to 26% less than those in surrounding states, which he believed was a major factor contributing to the state's struggling healthcare system. Whitehouse stressed that CMS's one action to address the issue had only worsened the situation, and despite his repeated efforts to bring attention to this injustice, including discussions with CMS leadership, no meaningful change had been made. He pointed to the AHEAD program as a potential avenue for relief. While Rhode Island was a willing participant, he expressed concerns that Connecticut, the next state to follow Rhode Island in the program, might suffer the same discriminatory treatment in payment rates. He had been unable to secure assurances from CMS that they were even aware of or concerned about this problem. Whitehouse highlighted the stark contrast in payments between Rhode Island Hospital, which provided more comprehensive services, including trauma care for the Secret Service, and St. Anne's Hospital in Fall River, Massachusetts, which received higher reimbursements despite offering fewer services. He described this as illogical and called for immediate action to fix the system, emphasizing that the situation was not a minor issue but a matter of significant importance. The senator also raised another issue that had been a point of frustration for him: end-of-life care. He criticized CMS policies that forced families to endure lengthy hospital stays before transitioning to a nursing home for dying loved ones. He argued that it was both cruel and unnecessary to prevent palliative care from being provided alongside curative treatments. Furthermore, he expressed dismay that respite care services were so limited and often required families to transport their loved ones to hospitals instead of providing care at home. He insisted that Rhode Island could serve as a model for improving end-of-life care and that CMS should work with the state to craft a better system. Whitehouse's frustrations were clear, and he acknowledged that much of the issues at hand predated the current administration. He described his efforts as futile and recounted how he had previously placed a hold on Biden nominees in an attempt to get CMS to address these concerns. He expressed impatience, citing a lack of progress on the key issues: closing the payment gap, balancing the AHEAD program regionally, and improving end-of-life care. In response, Secretary Kennedy acknowledged the issues raised by the senator, reiterating his commitment to addressing them. He mentioned that he had heard similar complaints from Vermont and recognized the importance of resolving the disparities. Kennedy offered to meet directly with Whitehouse and promised to bring CMS leadership to the table to discuss potential solutions, especially in regard to end-of-life care, which he agreed needed to be re-examined. However, Whitehouse expressed frustration that despite his numerous attempts to reach out, he had not been contacted by CMS staff. Kennedy reassured him that he was committed to working on the issue and encouraged the senator to reach out directly to him. The exchange reflected a growing tension over the inefficiencies of CMS in addressing critical healthcare disparities, with both parties expressing frustration over the lack of progress despite repeated discussions. Whitehouse's plea for action underscored the urgency of resolving the issues affecting Rhode Island's healthcare system, while Kennedy's response highlighted a desire to engage and collaborate, albeit with an acknowledgement of the challenges in coordinating action within the large bureaucracy of CMS.